Hi everyone, welcome to the COVID-19 contact tracing information training provided to you by your friendly local contact tracers from the Western Oregon University Community Health and Polk County COVID-19 project. This training was recorded on March 9th, 2021. In this training, we will discuss what contact tracing is and how it works. We will define what it means to be a close contact, explain the difference between quarantine and isolation, and share what you should and should not expect from a contact tracing call. So what is contact tracing? Contact tracing involves public health team members, WU community health students if you live in Polk County, calling individuals to notify them that they have been in close contact with a person who has tested positive for COVID-19. If individuals are notified early that they have been exposed to a person with COVID-19, then they can quarantine and help prevent spreading the disease further. Contact tracers help by explaining how to prevent the spread of the virus, including staying at home or at a separate location until the risk has passed. This is known as quarantining. They also provide information on how to care for yourself and others if you start having symptoms, and they share resources available in your community that can support you while you quarantine. According to the Centers for Disease Control, for COVID-19, a close contact is defined as any individual who was within 6 feet of an infected person for at least 15 minutes over a 24-hour period, even if both people were wearing a mask. Recent CDC guidelines have also defined close contact as having direct physical contact such as hugging or kissing someone, sharing eating or drinking utensils, or if an infected person somehow sneezed, coughed, or in any other way managed to get respiratory droplets on you. To be clear, any amount of hugging, making out with, or getting sneezed on by someone with COVID counts as a close contact, whether or not it lasts a full 15 minutes. So don't just set a timer for 14 minutes and 30 seconds and think you're good. Here on the Community Health and Polk County COVID-19 project, one of the most common questions we are asked is about the difference between quarantine and isolation. What's the difference? Is there even a difference? Is quarantine just an Italian word applying to ships in the 1300s during the bubonic plague? Well, yes, there is a difference, and that is the origin of the word, but it also applies to modern-day infectious diseases that we're trying to control. Individuals who are close contacts of a person with COVID-19 quarantine. Quarantining is used to keep individuals who might have been exposed to COVID-19 away from others. The quarantine period is 14 days following the last exposure to the virus. During this time, individuals take their temperature and watch for symptoms of COVID-19. While a 14-day quarantine is the safest option, recent CDC guidelines have provided details for certain situations where you can end quarantine earlier. This applies only to individuals with no symptoms who do not live with a positive case. If an individual has no symptoms and they haven't been tested for COVID-19, they can still end quarantine on day 10. As you can imagine, this gets a bit complicated, but that's what contact tracers are there for. They know the ins and outs of the CDC recommendations and can answer your questions. Isolation is for individuals who actually have COVID-19. Isolation keeps people who are sick away from others, even if they don't show any symptoms. And this is important to remember since a large percentage of people with COVID-19 don't ever show symptoms. Individuals who are sick and or have tested positive for COVID-19 should isolate themselves from others in their home by staying in a different room or part of the house. If a person has symptoms, they will be asked to isolate and stay home for at least 10 days from when their symptoms first began. If an individual has tested positive but shows no symptoms, they should stay home for at least 10 days after their positive test. This might sound complicated too, but that's why you'll also be called by a county case investigator who can answer your questions. You also are, of course, encouraged to talk to your primary care provider. If you are a contact and need to quarantine, the person you'll speak with is a contact tracer. The WU Community Health and Polk County COVID-19 project makes up the contact tracing team for Polk County. We are faculty, students, and alumni of the Community Health Program. If you are a case and need to isolate, the person you'll speak with is a case investigator. The Polk County Public Health Department makes up the case investigators for Polk County. Both contact tracers and case investigators are employed by the local public health department and are here to help and answer your questions. Here's how contact tracing works. First, an individual finds out that they have tested positive for COVID-19. That individual, also known as the case, is then called by case investigators. Case investigators will tell them to isolate for 10 days, and they'll also collect information about any individuals the case has had close contact with while they were contagious. These people who are potentially exposed to COVID-19 are called contacts. While the person who has COVID is isolating, contact tracers will then reach out to all the contacts. They will tell these contacts they have been exposed to someone who has tested positive for COVID-19, but they will not include the positive case's name. One thing to note, none of this tracing can be done if a person doesn't answer the phone. So we know you all don't like to answer phone calls from unknown numbers, but that's why case investigators and contact tracers leave voicemails. And don't worry, if you miss them the first time, they'll check in the next day as well. Contact tracers will ask contacts to quarantine and help connect them with any resources they might need. They will then continue to call or text the contact every day to keep track of their symptoms and temperatures. If a contact begins to feel sick while they are quarantined, they will be encouraged to get a COVID test. If they do have 2 of the following symptoms, fever, cough, loss of smell or taste, or shortness of breath, or test positive, they will be referred to a case investigator. The case investigator will identify the contacts, and around we go. But hopefully not, because hopefully everyone isolated and quarantined and we are able to stop the spread of disease. If you are called by a contact tracer, this is what you can expect. First of all, they will reach out to you by phone and tell you they are from the local public health authority. You will talk to a real person, not a recording. They will ask you if you need an interpreter for the conversation, your name, birth date, and address, if you have symptoms of COVID-19, if you need a place to stay, if you need food or have other needs during your quarantine period, how they can contact you for your daily monitoring, and they will ask about your race, ethnicity, disability, and language information. Since you have been potentially exposed, you will be asked to quarantine. This means staying at home or a place provided by the local public health authority for 10 to 14 days, as well as staying away from others in your home as much as possible. Essentially, you should only leave if you need medical care. Throughout the quarantine period, contact tracers will ask you to check yourself daily for symptoms. This means taking your temperature twice a day, once in the morning and once in the evening, and keeping track of whether you notice any symptoms. Contact tracers will then check in with you each day to record these temperatures and symptoms. If you start developing symptoms, they will provide you with more information about testing and resources. Unfortunately, there are some scammers out there. If you are concerned a contact tracer is a scammer, you can call your local public health authority to verify information and workers. These are some things that legitimate contact tracers will never do. We will never ask for your social security number. We won't ask for your bank account or your credit card information. We will not ask about your immigration status. Your information will not be shared with immigration authorities or with law enforcement. In fact, getting tested or getting treatment for COVID-19 will not affect your ability to get permanent residency in the United States. Contact tracers will not threaten you if you decide not to talk to us. You will not receive an initial text with a link to click on. Your first form of contact will be a phone call. Finally, a real contact tracer will never provide any names of other individuals. All information in a public health investigation is kept private. Meet our contact tracers. These are 3 current contact tracers out of our team of 15, and they've each shared their favorite part of contact tracing. Sonia enjoys helping people and their loved ones during difficult times. Sarah shows that contact tracing can be done from pretty much anywhere, and also says that she's happy to help keep our community safe. And Gabby expresses something we hear a lot from our contact tracers. She says, "My favorite part about contact tracing are the expressions of gratitude and care given to us by our contacts. Hearing their sincere thank yous through the phone and hearing the happiness in their voices when they say, 'Thank you for calling and continuing to check up on us,' makes all the difference in the world." Finally, we've included some reliable sources if you're interested in learning more about COVID-19 and contact tracing. And that's it. Thank you for watching this training video. This presentation was created by the WU Community Health and Polk County COVID-19 Project, which is a group of community health faculty, alumni, and students who have worked through the past year to provide contact tracing and health education in Polk County and within the WU community. We appreciate your time.